Vulnerable populations. Vulnerability is defined as an increased susceptibility to health and healthcare disparities due to a combination of individual and environmental factors. Vulnerable populations are ethnic minorities, elderly, homeless, low-income persons, and those with chronic diseases, illnesses, including those who endure violence, drug use, and mental illness. Social determinants of health are considered conditions in the places where people live, learn, work, and play affect a wide range of health risks and outcomes. The following determinants of health can impact health outcomes. Our childhood experiences can shape people we become. Someone growing up as an ethnic minority in poverty, they are more likely to be exposed to risk factors like low income, violence, or poor education. Housing is important for safety and shielding one from outside threats. The homeless suffers from inadequate housing and are exposed to many environmental risk factors. Education achievements are shown to have an impact on the expectancy of life, employment opportunities, income, access to healthcare, and health status. Our social environment is consisted of interactions with family, co-workers, friends, and others in the community. Also, our cultural norms and attitudes. Low levels of support create negative influences on health outcomes and can be spread from one another, causing poor health behaviors and attitudes. Family income can determine the ability to get access to healthcare, housing, food, and other essential needs. Employment status, such as unemployment, creates barriers for access to healthcare, receiving an income, inability to provide and meet daily needs to maintain a healthy lifestyle. Our communities relate to socioeconomic conditions such as exposure to crime, violence, poverty, culture, drug use, and language barriers. A person who grows up in a community with high crime and drug use rates are more at risk for developing those unhealthy behaviors. Barriers such as financial, insurance, and transportation issues limit access to healthcare services and increases the risk of poor health outcomes and health disparities. Social determinants of health determine health outcomes, including morbidity, mortality, life expectancy, healthcare expenditures, health status, and functional limitations.